And then after that, you tackle problem number 2, the less serious, the less recent, and then problem number 3, and then the other chronic problems. And then in the end, you want to mention, what DVT prophylaxis you're using, and it's okay if you think the patient has low risk for DVT, and you can just put like encourage ambulation. Nutrition is also important, and you have to think about nutrition in every single patient and the type of diet order that you put in, and then the cause status and surrogate decision maker of the patient, and then the reason for continuous hospitalization, what's the active issue, why the patient is still in the hospital, and then expected lengths of stay. This is really maybe more important in the HMB. We need to know if you think the patient is appropriate for observation, which by the Medicare definition is basically the patient will need only 1 or 2 nights overnight in the hospital, and then they can be discharged. Or the patient meet criteria for inpatient, and they're most likely going to stay, more than 2 nights. And you have to support that decision in your documentation too. But again, in every progress note, it's useful to kind of tell the reader, the nurses and the staff who are reading your note, when do you expect the patient to be discharged? And then what's the functional status of the patient, and what's the discharge plan? Do you think the patient is going to go, most likely will go home, or home health assisted living facility, and or short-term rehab, or a SNF, et cetera, et cetera. I think that helps. Also, again, the case managers, social worker, nurses who are, taking care of your patient as well, to know what to expect. And it's always good to kind of communicate that with them directly if possible. So let's take an example. I want you to pause the video and read this note, or part of a progress note, and outline 3 things that you like about it, and maybe 3 things that you dislike about it, and then we'll go into some more details in the next slide. So apart from some spelling and grammatic and punctuations issues that were fixed, in the short case summary, I would like it to include more information about the way the patient presented. That is to say, the order of onset and duration of symptoms, for example. Assessment of the clinical progress can be added to the patient's number 1 problem to give a better picture about how the patient is doing clinically. So this is regarding the clinical vignette. With number 1 problem, it's always nice to start with an uppercase letter. For the assessment section, the main diagnosis is very clear, and there is a good layout of the clinical and lab features that support the main diagnosis, which is important, and it's clear in this from that perspective. Although it's not clear whether this is the first presentation of heart failure or an exacerbation of a previous diagnosis of heart failure. And if it is an exacerbation, we would like to know what is the cause of the exacerbation. Also, this is where there should be like a statement about how the patient is progressing. Like the patient is getting better, the patient is getting worse, stable, unstable, this kind of things. Okay, for the plan section, it's a little bit kind of disorganized and has some contradicting statements regarding diuretics therapy, which is very important part of the diagnosis. It seems that the new plan is added below at the bottom of the note, but the old plan on the top was not deleted or edited. Whenever you do copy pasting of your assessment, you must review what you copied and edit that accordingly, rather than just add new information at the bottom of the note. So be mindful about that. I think that's one of the most common issues I have seen in the most of the notes that we write. So taking all these points into consideration, you can tell that we can make the note look and read much better. So again, pause the video and read this newly edited note based on some feedback from your colleagues, and see if you really appreciate the difference between the two.